Hello, good evening, good afternoon, good morning, wherever you are in the world, and welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I am a professor in the Medical Education Research and Development Unit in the Faculty of Medicine at the University of Malaya here in Kuala Lumpur, and we're coming to you live this evening. We've had a fabulous weekend insofar as we had another grading. Now, we up to blue belt, and beyond green belt and up to blue belt is a significant step in the skills. And Ken, Shavita, and Adarsh did extremely well, excelling in all dimensions in their skills. Some of them have joined this evening, and I'm sure they'll share their insights as well. It was thrilling to see them develop the skills, but it also reminded me that development of the skills is iterative over time and is layer upon layer upon layer. As I go to Eido and train in the art of drawing the sword every Sunday I learn something new, going back to basics. And what was interesting is that I used to do my horizontal cut. And it was described to me previously as like snapping of a twig. But I always thought that was a sound made as the sword left the scabbard. Not the case. There should be no sound at all. And the sensei chastised me for generating sound as it did in the kids' game. And now I have to go back and practice the very basics and make sure that the right hand is supporting the sword as the left hand is drawing the scabbard or saya back. These little bits of deconstruction are so important in mastering a technique. But they were never communicated to me in the beginning of my journey of Eido. And to be honest, chatting to many of the students, and we're now up to 34 in the face-to-face Black Belt Academy, 4 master students have joined us. And what's interesting, they too are now saying some of these basics and obvious tips and tricks have not been communicated at all in their careers. And now they're in surgical programs. This is worrying. Very worrying indeed. But that's why we established the Black Belt Academy, is to try and deconstruct it and build on skills. So the skill we're going to be talking about this evening are the scissors. Now, the scissors really reflect your respect for the tissue. Poor surgical technique, crushing, twisting, sawing, leaves traumatic edges and a signature on the wound and increased inflammation. So the principle is light touch and constant awareness of where the tip of the scissors are and the cutting edges. And in many respects, the scissors or use of the scissors reveal your stage of training, and consultants can often tell how experienced you are simply by watching how you hold and open a pair of scissors. Stability, finger position, plane recognition are honestly all there to see. They might not know what they're looking at and might not be able to put a finger on why it doesn't look right, but they can certainly tell you a lot more. So scissors, the origin goes back to Egyptian days when they had 2 blades on a hinge, and you probably saw in your grandfather's garden shed 2 blades with a metal strip, and they used as garden shears. And it was the Romans that took these 2 blades together and put a pivot to allow them to be used, mainly for hairdressing, cutting beards, and sometimes circumcisions. But they're the ones that came up with the word scissore, which is translated into scissors, which is an interesting anomaly in the English language because it's a plural, tentatum, which means that there's no singular for scissors. We say a pair of scissors or lots of scissors. It's two blades on a pivot. But the scissors really came into being in 1741 with Richard Hinchcliffe, who in Sheffield, with the advent of steel and metals, commercialized the scissors. And as we've discussed before, with all surgical instruments, improved metalwork, improved technology, improved surgery with the sterility, and now we've got a plethora of scissors. The common scissors that we come across in the kitchen are these, and note that you can get 3 fingers in that side and a good thumb in that side because these are meant to grip and do heavy boning, cutting of joints, meat in the kitchen, and that requires a gripping technique. But the surgical scissors, and this is one of my favorite, are the McIndoe scissors. And the McIndoe scissors are named after Archibald McIndoe, and I put his biography in the reading material. He was from Waikato, New Zealand, was spotted by Monaghan and brought to London to work with Gillies at Bath, who is an ENT plastic surgeon. And before the war, he did a lot of head and neck work, and he moved out to East Grinstead to establish the plastic surgical unit, which became famous for dealing with horrendous burns and disfigurement of young Spitfire pilots. He created fantastic flaps to reconstruct the faces, and these scissors are named after him. He became the first president of the Royal College of Surgeons of Plastic Surgeons, and he was more than just a surgeon, because I like him. He looked after the dignity of the pilots, ensuring that they wore their uniforms when leaving the hospital to go into East Grinstead village. He only employed good-looking nurses who wouldn't be reviled by their disfigured faces, and they set up the Guinea Pig Club. Apparently, a lot of the young men married the nurses as well, but he was also a scientist because he noticed that the pilots who ejected into the sea, their wound healing was better. So another part of this fantastic, gifted surgeon was his powers of observation and natural inquiry, which led him to look at wound dressings. But the scissors teach you everything. Now, we use this with a grip in your fingers through there. I'd like you for a moment, as previously, just to stroke your face with your knuckles. Yes, not very good, but now stroke them with the tips of your fingers. And as we've previously said, you've got 5,000 sensory corpuscles per centimeter squared in the tips of your fingers. And really, we should be feeling our instrument. And I think the principle of holding instruments is to maximize the surface area of the pulp of your fingers on your instruments. And nothing could be more true of scissors. The thing is also, as soon as you see blanching, that is pressure, and that is not feel. You see, the feel is everything. And on a well-made pair of scissors, the balance is everything. The pivot tolerance is precise, so the blades close under its own weight. And when you hear the blades close, and this is a longer version than Nelson's scissors, for reaching in to cavities. You see the shaft and longer shaft there. And listen, you can hear that scissor sound, indicating high quality engineering. And the scissors teach you more than cutting. They teach you to feel. So every pair of scissors has a unique balance and tension and resistance. And when learning to use the blades, you've got to understand that balance and because otherwise they will chew the tissues and create trauma. So then lots of scissors, pot scissors, micro scissors, medicine bottom scissors, vascular scissors, micro scissors, they all do the same. But understanding the feel is important. This evening, as we go through the scissors, I'm going to point out layer by layer each belt for scissor skills and demonstrate the low fidelity models that we use to test each of these skills. And together with my new sensei in the face-to-face, Ken, Adesh, and Shavita, we are now quantifying and making our score sheets even more binary to enable accurate assessment and scoring. We had a paper accepted in the June version of the Journal of Surgical Education, which really criticized OSATs because a lot of the observation was subjective and didn't give objective scoring. So with each of these belts, we have objective scoring, binary pass and fails, and we have a global rating scale on competency of tissue lightness and handling as well. So let's start. We'll start off by coming over the top and examining the scissors and appreciating their anatomy and how to hold them. You see there's a curve, a natural curve of the scissors. And this natural curve, it's important to be aware that the curve needs to sit with the curve of your wrist because one's gathering all the time. But more importantly, as you look down at the scissors, you can see the curve of the blade and you can see the tip. I've seen dissections of the segmentectomies or lobe resections in the lungs where the scissors have been held upside down. People are focusing on the tip, but they can't see the belly is slicing through the pulmonary artery. So to appreciate the feel, I'm going to turn my hand upside down and note that I got 1, 2, 3, 4 palps of fingers feeling the scissors that is just sitting on a triangle base and stability. And the movement is very, very gentle. And you're feeling the tissues. Because the ends are blunt, you may use these to probe tissue as well and to feel. And as you dissecting planes and separating tissues, you might feel a little bit of resistance. That could be a cutaneous nerve. And cutting it would render the area numb. So being aware of your anatomy and feeling your tissues, you can identify critical structures. The other important thing is you never open the scissors any more than necessary to do the job. And that is usually about 4 millimeters. With the index finger down here, you are giving direction to your dissection, but actually if you open it up too far and your finger drops through, that is definitely a no-no. One shouldn't ever see the scissors open that wide. Perhaps maximum, but most of the time it is millimeters, as you can see there. So the hold is very important, and we'll come back to examine the hold as we get up to blue belt, where we introduce the inverse grip. All the way through the belts, if we see blanching of the fingers and gripping, that is not feeling the instrument. Just hold it again. You can see, although I've got a black fingernail there, you can see I'm gripping and holding. Now, I appreciate that for many ladies and many people with smaller hands, that the finger might go through to the DIP joint. Remember stroking your face with your knuckles, did not feel smooth. Kavitha, could you turn your camera off, please? Thank you very much indeed. So your finger going through does not give you that feel. So although the instruments, and this is historical, that these instrument rings are large and there's no female size for smaller hands, and that is being addressed, the best thing to do is put your finger obliquely across such that you can hold it on the oblique and maintain the feel of the scissors. So the first skill we do is cutting out shapes. And in developmental terms, cutting out shapes regularly and accurately should be achieved by the age of 4, and is used as a developmental milestone in children. But what we ask you to do here is cut out a shape, and I've usually got black circles, black squares, and we cut out without leaving any white, and we cut out without leaving any black. And the interesting thing is, I was wondering as we tried this the first face-to-face, I was thinking, gosh, I didn't bring any black background to hold up the circles and squares, until I suddenly realized that all the medical students in the Faculty of Medicine at the University of Malaya wear black scrubs. So you might see on our Facebook reels, one of the skills at Yellow Belt is cutting out circles, and the candidates are holding the circles up against their tunics. And putting it against a white background, you can see what's left over and what is excessive. This is somewhat easier. All I have to do is cut down the middle of the line and hopefully not leave any white or black at all. So as I look at the paper, I should have black all the way around. And as I look at this, I should have a rim of black all the way around as well. I've stuck to the line. That's fairly easy with a curved scissors as you're going around the curve. But what about a straight line and squares and rectangles? Again, to enable you to do that, it's important that your cutting is using the smaller part of your scissors. So it's little cuts. And using the tips rather than opening up. If I start opening up wide and doing that, you can see I've gone off center. All right, so I've got to keep my cuts and nibbles, and it is literally nibbling, small and straight. This gives you visible feedback and defines the accuracy and control of your scissors. Because to keep it on a straight line, one can't go opening it up very wide. We also encourage people to use forceps to hold the paper and to maintain. Coming down the middle. And again, what we expect at every stage, even at black belt, we might indeed ask our black belt students to cut out a shape, because these are skills that are fundamental. And at black belt, we're looking at the control and the feel and how they hold the instrument. Okay, so there you go. I've left a rim of black there and I left a rim of black there. So that's the cutting element of scissors. But there's another element of scissors that you're probably aware of, is that if you hold the scissors slightly open, one can, and develop a plane, one can use the shearing of that to shear a bit of paper. So by way of an example, I'm using some baking tray paper here, okay? and I am going to demonstrate the shearing. So now this is coming to yellow bound. Make an incision, and I'm also wanting to shear and keep it about 1 centimeter, or even for 10 centimeters up. You can hear the shearing, and I should have a uniform piece. Now I've gone off to the side there. We want some better control than that. So we'll need to do it again. But that's what the shearing is involved. And although we're not pedantic about the dimensions at this stage, because this is a developmental stage of use of the scissors, later on, as you get to black belt, we'll ask you to do this again and demonstrate that you're able to shear the paper accurately. And I should get 2 centimeters of this bit all the way up. Okay, so that's yellow belt. Okay, shearing. But now we have understood how to actually open the scissors, cut as well using the tips. There's another important bit. To be able to develop a plane, one needs to open the scissors. To develop a plane, you never close the scissors if you can't see the tip. So it's open, withdraw, close, open, withdraw, close, open, withdraw, close. But now we're going to introduce you to the sausage. The sausage, and I have found, I need to just found that we can get beef and chicken sausages here in Kuala Lumpur. Let me get a bit of tissue just to wipe it up because it's a bit messy. I don't like messy. You could say that's a bit of blood. Let me just wipe that up so it's a bit clean. Clean up. Okay, so the sausage turns out to be a wonderful, wonderful test. Now, the idea here is the skin of the sausage is thin, like a tissue layer. It's not too dissimilar to a hernial sac or any tissue plane. So I need to identify a tissue plane here and find the tissue plane. And I'm going to start where I can take the tip off around the corner, but I've got an opportunity to lift the tissue plane up there and make a little cut. Okay. Now I don't want to be cutting into the flesh. So open, withdraw, open, withdraw. See, I can now cut this. I can look at what I should be seeing is clean, thin film of the sausage underneath. And I can use the scissors to probe and separate and push down as well. I find this a fantastic model, and I think the students who were introduced to this model were likewise really engaged in the fact that it gave you such fabulous feel and feedback. So what I want to be able to see as we're dissecting this is, again, I'm using the scissors, and I'll zoom down a bit, as a probe. To assist my dissection. I can open it up, and what I should be able to get is clean film of sausage there without any meat on it as well. This also is at the same time using some forceps skills, but like all dissection, if you're operating on a large plane, you'd then use an assistant to actually hold and retract so you can explore over a larger area the plane. And the fabulous thing about this model, it is very, very sticky. All right, there you go. You can see my scissors underneath there. And now I can use my shearing technique and keep the points up. And hello, I've just separated a tissue plane. So this is what you might find on the adventitial of a vessel. So once you've got in the plane, you can keep the points up, as we did in our yellow belt, and shear the skin off. There you go. And because I've got the points up, I'm not sticking them in, I'm lifting the points up a little bit. That's enabled me to make tremendous progress with this dissection in a relatively short period of time. And this is a fabulous way of dissecting and using the scissors to tease and probe. And you're almost using it as a blunt instrument. Okay? And it was very interesting to watch the students engage in this model at Greenbelt on Saturday. We had another 2 Greenbelts qualify, and without lightness of touch and without feel, you can immediately see lots and lots of flesh or sausage meat on the skin. And I should be able to get it all off. So it's nice and clean. Reminds me of doing hernias as I was learning surgery when I first started out in 1987. And to be honest, we were practicing on patients, and I don't think that is applicable at all any further. Practicing on this skill will enable you to be a lot more confident in theatre with your forceps, with your scissors, and lightness of touch. Personally, I find this one of my favorite models we offer for practice. And I want to be able to see that the sausage underneath is intact and not macerated as we have dissected off the plane. And guess what? It's organic, it's sticky. It's been out for a while, so therefore I'm not going to cook it or use it. But if it hadn't been out for a while and I had previously thawed and frozen it, I'd be happy taking this and sticking it in a sandwich later. This is called sustainable surgery. Right, okay. So what we're going to do now is look at how do we operate at depth. And to operate at depth, and I'll come back out a little bit, we are now coming up to the blue belt skill. So if I take my hand over the top, you cannot see the bottom, can you? Because my wrist is in the way, and I cannot see it either. So now we have to think about how do we hold the scissors to achieve that. And this is the inverse grip. So this time, I'm holding it on the palm of my thumb, my index finger, my ring and 4th finger are stabilizing it, and my 5th finger is down the shaft. And I'm holding it up like that. So if I put my hand over the top now, I can actually rotate this around and I can have a better view as I'm looking down here of my dissection. This is fantastic if you're dissecting down small holes, small chests. Vanish tells me a lot of the pediatric cardiac surgeons in Melbourne were using this in dissecting on hearts of walnut size. They're your heart's the size of the fist, and in babies, their fists are walnut size. But this is also very good in the oral cavity and in the nose and constrained spaces. So how do we actually practice this? Well, let's introduce you to the blue belt skill. Excuse me. As you peer down this pepper or caspicum, you will note in this cavity, I've got lots and lots of pips. And this requires the skill to, and I'm just trying to line it up so you can see the pips, make it straighter. So I am looking down into the cavity and you can see all these pips here. So with my scissors held upside down, I want to be able to either cut these off or open the tip off, and guess what? I can scrape these off. So using my scissors as a scraping tool at depth, but also sometimes they're stuck. So I pick it up with a pair of forceps and I'm dissecting the pips off. A lovely way of practicing your scissor skills down a deep, dark hole. And I've got them slightly opened to give me that shearing technique here, upside down, which is easy. But if it's stuck, I then have to nibble, 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 nibble. If you want to combine this with a forceps skill, take one off, pick it up, and drop it into a straw, which is blue tacked to the side. That's a little bit stuck there. I'm going to have to do a little bit of nibbling. And there we go. Marvelous. I have to cut that off. But some of these don't come off easily, and you have to take them off the plane. And there you go. I've cut the drift out of sight, but I've removed all the pips from that. What's great, you got three aspects of this. You can challenge yourself on the smaller holes as well and do the same thing. But what you're doing is feeling the resistance. When you've got resistance, you cut. When you haven't got resistance, you can take it off by scraping. Right, terrific. Now, the next part of your scissor skills is you're often asked to cut sutures. And we don't cut string with McIndoe scissors, but I can cut cotton. And what I want to be able to do is not come in wide open like that with cutting. The cutting's got to be into the area, open up just enough to do the job, cut and withdraw. If you find it got a problem with that, use your forceps as a fob, place them there, take your scissors into the surgical field, open and cut. But how much do you cut? Well, this is now a chance in our training, as we get to higher level, is to ask you to consider cutting 1 centimeter segments. This is not asking you to cut 11 millimeters, it's asking you to cut 1 centimeter. So cut, we can put it down. I think that's slightly short, that's probably 9 millimeters. And withdraw. And again, this is asking forceps skills as you're holding it and cutting 1 centimeter. Cut and withdraw. So I want 3 there, all right? And then I also want you to do 5mm one. So how accurately can we cut for 5mm? Probably 4. So what we want to see is controlled, and that's a bit long. That's not 5mm. That's 6. I'm going to cut a millimeter off that. Okay, so let's have a look at this. There's a rule. I'll put that up against there. What did I say? It was 9mm. It's probably 9mm. Not a centimeter, but it's 9mm. I'll put that one up against that one. Oh, yeah, it looks like it's 9mm again. So I'm coming short, but consistently, and that's 8mm. So I've got a 998. What about the 5s? Well, I said it was 4mm. And that's 4mm. I think that is well short. That's probably 3mm. There you go, 3mm. All right. But what we're trying to do is get you to consider cutting accurately without snatching at it, but now starting to think about the depth. So we're going to come back to purple belt now. And we've done some scraping, and we have done some dissection of the sausage on the plate. Well, let's make it difficult, shall we? Let's stick the sausage in the glass at depth. Okay? And what we need to do now is continue our dissection. And can we dissect the rest of the skin of the sausage at depth without tearing the skin and tearing the sausage? So this is now bringing into play all your scissor skills, but now we're going to be doing it in a cavity at depth. And this is what I'm hoping to see from our purple belt graduates. So the sausage we'll use again, but I'm cutting and dissecting and gently peeling off the rest of the skin. And I'm starting at depth. There you go. There you go. And what we want to see is control, lightness of touch, appreciation of the tissues, accurate dissection, because now we are actually limiting your movement and limiting what you can do. See there, nice clean skin. And I can use the scissors to dissect this off. So ease and squeeze, not ease and squeeze, but gently removing the skin. And hopefully I get the skin coming off with very little in the way of sausage material. And at depth, this is now really challenging your skills because you're limited in space. So there you go. And I can cut and get clean skin sausage. And again, it's another one of these models that I really enjoy practicing with and doing because I find myself getting engrossed. And you probably notice that because I get silent. Also, because I end up concentrating, I've got a bit of excess sausage there, but that's back in the right plane. There you go, there's the right plane again. So all of this is extremely difficult. And what we don't want to see is macerating of the tissues like that. So there you go, purple belt. So you're thinking, oh, golly gosh, this is now getting awfully difficult. So how are we going to top that in our skills test? Okay, let's go one bit further. Now, I like organic material because it gives you feedback, and I'd like to introduce you to our tangerine. The tangerine's got a skin on it, and it's got segments, and underneath the segments, there's skin on the tangerine as well. And what we want to be able to do is, and I'm going to use tooth forceps now, because I want a good grip of the skin to lift this up and try and cut the skin. Now the tangerine is actually balancing on a cup. It's not fixed into a cup, but I'm using the same principle here of gently trying to open and close the scissors. And this is the most difficult bit because it's the hardest area of the tangerine. And I shouldn't see any spilling of flesh. Now, the tangerines have got a very tough skin, and they're quite adherent to the flesh underneath. But patience is required. Patience is required. And I'm gently, gently easing this. And what I like about the Nelson scissors is because they're bigger, you can use them on a cortex and thicker cortex. And they've got much better cutting power, so to speak. But you've got to be careful using the scissors that you're not poking it at all. Because I can stick it straight into the tangerine underneath, and I can cause a lot of damage. Now, I'm holding the skin with the forceps. Again, this would be easier if I had an assistant who's holding the tangerine, because dissection is always easier when you've got somebody holding it. And I might actually help myself now by holding the tangerine myself. But then I'm going to use my fingers, and fingers are very good for holding tissues. They're atraumatic, you can feel, and over a long plane, I can hold that. And all I'm doing is nibbling, literally patiently nibbling all the way round to the other side. I'm going to have to expose more because ultimately I want to be able to remove a segment, and this is where it becomes rather fun. Again, it's confidence with the scissors. This is going to enable you to feel the planes of least resistance, enable you to feel your way through this rather sticky bit of flesh on this tangerine. And so far, so good. I have not cut flesh. Right. So I want to expose a bit more. I could cheat and actually peel it off with my fingers, but I'm not going to do that because I want to demonstrate the use of the scissors and how this can be a very, very useful, very useful tool for you getting to learn how to use the scissors with difficult tissue planes. You've got fibrous versus soft tissue all in one model. And if I was actually rough and I stuck my scissors in, I'd perforate the tangerine segment and I'd be in problems. So the question is, do I actually have now a segment exposed? And I think I probably do. And it's probably that segment there. Okay. Now we're going to take our McIndoe scissors, and I need to dissect that out a little bit further. And I've got a little bit of sort of fibrous tissue here. And I want this core that I want to remove that'll enable me to explore and get further down. And again, because I'm using fibrous tissue, I can use tooth forceps because it'll give me a better hold of this. There you go. Right, so let's see what we can do. I'm going to go to non-crushing forceps, DeBakey's, another one of my favorites. And there's no plane here as such at the present moment in time. So this is going to be a challenge. And I'm just going to confidently see the plane, but I'm just going to nibble a little bit and see if I can just cut that little bit of tissue there and start developing plane. So this is going to be the brown belt skill. And I don't mind how long people do it, but I'm wanting to see, and I'm mindful also of the time, but I'm not going to rush this because it's got to be accurate. And that's the thing. Even if I've got a hint of juice there, hint of juice, not a lot, but there's a hint. Oh, this is going to be a tough one, folks. I can feel it already. This is going to be a tough one. If you can't find it in one plane, move around, see if you can identify it in a plane further up. So when you're trying to dissect something, you're not working on one area at all. You're working across a larger area. And moving across to another area, you might get you into a better position. And what I need to do perhaps is give myself more space to allow this to move as well, because otherwise I'm not going to do two forceps in the Nelson to actually remove more skin. So very hard. And that's the thing about these bottles. If it's not hard, then it's not doing its job, to be honest. We need to create more space and not have these jammed in. all of this is fabulous scissor practice. Now, we're not going to set a time limit in grading session on this because it takes as long as it takes. What you need to be is patient. You need to sometimes just put your stretch, readjust your body position, readjust your hold, readjust everything to try again. So back to my non-tooth forceps. You'll find some tangerines quite easy, and other tangerines very difficult. Thing about dissection, again, I'm coming to our tip here. Sometimes one just has to be brave. But you can only be brave if you're confident with your instrument and you know your anatomy. Fortunately, the tissue planes of a tangerine are not traversed by neurovascular bundles. I could say talk amongst yourselves as I'm doing this, as I'm thinking, but I know Ken is watching and he's going to be going for his brown and purple bouts. And he's thinking, well, oh, golly, this is going to a different level altogether. It certainly is. And that's the whole idea, that one doesn't. Okay, now, like most dissections, you do reach a point, but it all does become a little easier and a little more well-defined. Using my blunt technique now, as I'm not cutting and I think I'm in the right plane. A little bit of juice there, but not too much. So the scissors are used in a lot of different forms here. Probing, pushing, separating, encouraging, all of the above. But it's getting there, isn't it? It is getting there. Well, that was quite useful. And I need to be able to come with this at all different sizes. Sides, not sizes, sides. Because the thing about developing planes is working over a wide area. I'm careful not to, I'm just gently feeling my way through here and trying to separate that out. And feel the tissues all the way. Let's come back to the side where I was holding the tissue, holding it up. Can I see the underneath now? I'm going to go my inverse cut because I'm down a deep dark hole. And see if I can actually encourage this out from underneath. If there's any more resistance. And again, as a model, this is jolly good fun. Using my forceps, there's a little retractor there, allowing them to open. Oh, there you go. There you go, folks. Dissected out, skin's intact. There's a little bit of juice there, but if we look at the side, there you go, intact, and that is the brown belt skill. You can take as long as you like, but what we're then going to do for black belt is come up and we're going to combine that all with the knife skill and the scissor skill to dissect out the femoral canal of a chicken leg, where we look at your tissue handling, forceps skills, scissor skills, and the balance between knife and scissors. We'll also combine at that level a brown belt or a black belt person to assist, because we expect at that level a degree of assistance as well. And we'll be assessing assisting skills as part and parcel of that. So there you have it. My favorite instruments. And it's understanding the feel and the balance, and it's on your fingertips. And unless you're holding it on your fingertips, you're not going to understand the tension of the tissues, how much pressure to apply, and literally feel your way through. As with that tangerine. Nice tangerines too. So there you have it. I'd like to invite my fellow senseis, Chris Cuddy and Prof. Seeley, and I did see Ken join, and Ken might want to comment on the sausage skill, because he was teaching, scoring, and doing it at the weekend as well. So welcome, Sensei. Do join the conversation and post questions in the chat and be happy to answer. Mr. Caddy.
I'd like to hear from Ken. So your brown belt skill and deposition there was superb. It was a stroke of genius. John Rudd and I were talking in the bylines about what you were doing and how you were demonstrating it. So well done.
Thank you. It's a nice skill, isn't it? The tangerine.
Absolutely. So Ken, turn your camera on.
I don't know if he is, but he can certainly talk.
Oh, right.
He might be in an untidy student room, but he indeed might have the black belt logo in the background. So Ken, if you're there, if you just see.
There's no visible microphone there, so perhaps he can't.
There's no visible microphone. No. But any questions from any of the other participants? Any observations, please?
Is Seeley there?
Prof. Seeley is here, yes.
There we go.
How are you?
I'm quite exhausted. Yeah, that's been a very challenging week, like almost every day. And in fact, recently, last night, I have a patient delivering the cesarean section,
Mhm.
but she also had the ovarian, borderline ovarian tumor.
Oh dear.
So
Okay.
she had this ovarian tumor when she was in 14 weeks pregnancy. So yes, they removed the ovarian tumor in one of the hospital.
Mhm.
And then after that, she came to us for a follow-up with us. And then now she's on at term at 38 weeks, and she progressed. She's rupture membrane herself at home.
Mhm.
So she came with the
So you're busy,
yeah,
busy
all
man.
sort of things.
So
Yes, yeah. So
what are your
obstetric is
insights?
very unpredictable, and then plus, yeah. All
Yes, I
right.
imagine.
It can be like a mix. Yes, yeah. Very, very unpredictable
I imagine.
obstetric
So
mixed with the
from your point
yeah.
of view,
Mm.
you always got some fabulous stories. So your scissor experiences and your
Okay.
observations on the models.
All right. Okay. Yeah. Okay. Back to that cesarean section. Yeah. All right. Initially, we started with the skin cut with the knife, the shaft knife.
Mhm.
And then when we reach the rectus sheets that,
Mhm.
we split the rectus sheets, yeah.
Mhm.
And then after that, we went into the peritoneum. So it's like now, when we were younger, we were taught that, it's like how to open up the peritoneum, the two arteries, lift it up and then make it very thin and then cut with the maximum Caesar. And then we were taught that, yeah, every instrument they have a very dedicated function. So for example, it's like if you want to cut the sheath, the tough sheets, we are not supposed to use the maximum, the
Yeah.
tiny, yes. And then we have to use like a kind of
Heavy Mayo scissors.
AOC Caesar.
Curved mayos.
So,
Those are straight mayos, but the curved
oh no,
version
curve
is the
mayos,
curved
bro.
mayo scissors. Again, bit
Curve
like
mayos,
the
yes.
curve gives you
It
that
is to
extra
follow the
angle with
curve,
the
yes.
wrist. Yes. Yes.
True, yeah. And then nowadays, even peritoneum, because like sometimes it's very tough peritoneum, you don't know what is below the peritoneum is that, it could be the bowel or a bladder. So now what I'm doing is that just blunt the section, even without Caesar, just go in, make it until the thin peritoneum.
Mm.
Sometimes it can be a distended bladder below it.
Yes.
Yeah, even we
Yes.
put the catheter in. So one is that I try to avoid even the Caesar when we enter into the peritoneum. Yes, this is number one. And
And
number two is that,
the peritoneum falls over the bladder comes
yes,
up, but
yes,
peeling the peritoneum off the abdominal wall.
yes,
But
bro.
you have to find the right plane. Otherwise, you do
Yes,
end
bro.
up with your scissors through the bladder, don't you? Very easily,
Yes,
or through
prof.
the
Yeah.
bowel as well. Mm.
Yes, especially sometime like patient have one previous cesarean section before, two
Mm.
previous cesarean section before. So there will be adhesions, a lot of the
Yeah,
adhesions underneath it. So that is another challenging, All right, so go by blunt dissection from the side,
certainly.
the approach.
You go
Yeah,
from
approach
normal
from
tissue to abnormal tissue and then find your way in, don't you?
definitely.
But
Yes, yeah.
But it literally is. You need to know your anatomy, but you're feeling your way in from normal to abnormal each time. And sometimes
That's
it
why
is
you you
very
you taught us
distorted.
the feeling.
Yeah.
Yes,
And
yeah.
that's where the feeling comes in. But the
Yes.
trick is also is knowing which plane you're in. And this tangerine is also very important because doing a pericardectomy, it's a bit like taking the skin off the orange, but it's so easy to go into the epicardium. And you go into the epicardium without knowing it, you can start taking off the cardiac vessels and you've got enormous amount of bleeding. So understanding and feeling that difference in the tissue and that plane is all part of how you hold the scissors. And that's why I love the tangerine, because it's mixing
Yes.
fibrous tissue, soft, juicy tangerine underneath, and you get immediate feedback if you actually enter the wrong plane, because you get juice all over the place. And that is a bit like taking the cortex off a heart. And very quickly, you can end up in the wrong plane. Likewise, in a reduced stenotomy, in a large heart, I remember opening a reduced stenotomy with oscillating saw, because you up and down like this rather than a saw, oscillating saw like this. And I started to lift off the sternum to try and dissect the heart off the back of the sternum. But as I was lifting slightly, the thin right ventricle was plastered to the back of the sternum. And I started dissecting and noticed that there was a little tear appearing in the right ventricle. So I called Steve Edmonds in and I said, look, I said to him, this is not going to be possible to redo this operation, because to take this thin right ventricle, which is plastered to the back of the sternum, free it without damaging the ventricle was going to be impossible. He said, let me have a look, and very quickly decided, correct, not possible at all. So we abandoned the operation. Not even on femoral bypass would have been possible to separate the two. So it's understanding that. And I did an aortic valve replacement on somebody who had a previous tissue valve because they wanted it and had a Lima to LAD. Now, the internal mammary artery runs just inside the breastbone here. And I'd taken it through a pericardial window, as I normally do, straight onto the front of the heart. But it was really, really stuck behind the sternum, thick and fibrotic, a bit like this orange skin. And to dissect it, and I had to redo the valve. So I had to dissect it out, preserve the mammary, find the mammary, which is in this thick fibrotic tissue. So I knew it was there somewhere. And all it was a patient nibble, nibble, open, nibble, nibble, open. It took a while, but I found the mammary. I was able to isolate the mammary and get on with the operation. But it's all feel. Mr. Caddy, comment.
Well, I think what you're demonstrating there is both situational awareness and decision making.
Yes.
One of the main things about being a surgeon is knowing when not to operate
Or to
rather
stop.
than go on. Yeah. Yes, but there is a solution. You just don't know it at the time when it comes to you.
Sure.
And so you turn
Stop
to
it
you turn to your assistant and say, what would you do? So you've got somebody there, you're not on your own. It's about using your assistants as a sounding post to find out what you might do.
But even thinking it out aloud helps the cognitive process and vocalizing it, because they might not know, but you think saying it is actually enabling you to think deeper about the problem. But the other thing is, if you're stuck, as I was saying there with the tangerine, just stop for a moment. Drop your shoulders, relax your tongue, couple of deep breaths through the nose, walk around, and then come back to the problem from a different angle. Even go to the other side. It gives you a different perspective and a fresh start.
The other thing I was glad to hear is that at brown belt gradings, you're going to allow an assistant.
Yes.
Because I was talking to John Rudd about what I would do as an assistant at each stage in your operation.
Yes.
And when it was almost out there, the assistant would take the tangerine and hold it like that. So the planes then become obvious.
Yes.
And the segment pops out.
Yeah, but that's kind of cheating, that one.
No, it's not cheating. It's about using your assistant. It's situational awareness and decision making.
Yeah, exactly. I think Rosile, Dr. Rudd also wants to make a few comments as well. So why don't you come on camera, Dr. Rudd? Rosile, in the meantime, what comments? Rosile, you've gone. You back?
Yes, Prof. So the just now versus parietal peritoneum, and now we reach the visceral peritoneum where the bladder reflections on the uterus. Yeah,
Yes.
because this point of the time, I cannot stop the surgery because I have no choice to cut the uterus and to take out the baby.
Yes. Yes.
So that this point is no turning back. Yeah. So what happened that we have to incise the bladder reflection and push down the bladder down, and then we have to cut the uterus, yeah, to take the baby out. In virgin abdomen that she never had a surgery before, there is this very nice bladder reflection. You can push it down the bladder.
Yes.
But she had it the one previous scar, 2 previous cesarean section, 3 previous cesarean section before. The bladder will be blasted, very stuck at here. So maybe we may not push the bladder and we cut above the bladder and open up the uterus. Or otherwise, still have a possibility to push the bladder down and cut the uterus. So again, Prof. Chris mentioned about the situation awareness, and then in that case that we must tell our assistant that how to safely dissect the bladder down, because like a urologist is a good friend of us as well. Like if you touch wood, like if you enter into the bladder, and then you have to call the urologist to repair it, and at the bladder hole. These things can be happen when we were in the government hospitals. So we have like the surgeon is next to us under the same roof. Yeah. Yes. So we have to decide what to use, what instrument to use, whether you cut it, open it, or you don't cut it, open it, in that taking the risk. Yeah. That's the message, Prof.
Thank you. Dr. Rudd,
Dr.
your comments.
Yeah, good evening, David. Yeah, I've got a couple of points, especially about situational awareness. You will recall the paper that we wrote for the surgeon relating to advanced driving and surgery. Well, I learned something new a few months ago. I was offered a drive in an 8-gear car. It was a Jaguar, very powerful vehicle. And I managed to perhaps exceed the limit slightly and got it into 8th gear.
Yeah.
It was a very quiet road, to be honest. And I was going down 7, 6, 5, 4. And I will call him my instructor, said, no, that's wrong. You should go from 8 to 5, maybe to 3 thereafter, with a pause in between each change.
Right.
Now, that is now taught generally for a normal car of 5 gears.
So you can go 5.
And also if you have an automatic car, which people seem to favor these days, you can change gear in that into, I think it's 2nd or 1st gear. And you should pause slightly when you change. You should literally pause and then into 2nd.
Interesting. Obviously, as you're coming down the gear.
The other point I want to make is about number of attendees. I did put a little message on saying, look, You guys that watch this, please tell your friends and ask them to tell other friends, and so on and so on and so on, so that we can increase the numbers of people watching. And I also reminded them about the catch-up.
Yes, and that the catch-up will be
so
there.
that they can watch at any time of the day or night. And it's free.
Yeah.
And your instruction is the most exceptional instruction I have ever encountered in my life.
You're too
So
kind.
please, will you guys please try and get more people watching? That's the end of my screed for today.
Thank you, sir. That's very fact. So any comments from anybody else? Just an observation from anybody. Do you think that's a reasonable progression through the belts and skills and models? We can see it starts off relatively easy, but then it gets very difficult. But you can't do the difficult unless you've got the basics right. And that's the whole point. You can't start tackling, do not practice on the tangerine. Go back and practice on the simple things first. Be sure that you're holding it correctly. Because if you're not holding it correctly and you're not in the habit of holding it correctly, no matter how good your dissection is, you're going to run into troubles because the very fundamental is wrong. And again, going back to my martial arts training on Sunday, another important element of this is to enable your sword to come down straight is you let the weight of the sword do the work. And we'll come to the knife next week and we'll demonstrate this. But from there to there, from up there, moment down, 1.1 kilos of sword doesn't require strength. What it requires is accuracy and precision coming down. And to do that, there are a number of little tricks that, again, had not been communicated previously. And as they pointed out, unless you're holding the sword properly with the middle finger there and those two fingers there, so it's that one there, all right, holding at the top, and that one there, and your hands are aligned properly, you're not going to get the movement of the clean cut down. And he also pointed out, as we're doing the katas, in walking, you're transferring your weight, and Chris Kelly's doing Tai Chi, but propelling yourself forward with your back leg, not dragging yourself forward with your front leg. But your back leg needs to be perfectly lined with your front leg to ensure that your hips are straight. And without your hips being straight, your shoulder won't be straight, and your cut won't be straight, no matter how hard you try. So again, it comes back to the basics. And Carl, who I think is fourth or fifth down, he goes back to basics all the time to ensure that he's got the correct position, correct hold, correct stance to ensure that his cut always remains perfect. So with that, we will be talking about next week on knife skills. And again, I'll go through in the syllabus that we have on the knife, and they're obviously with a blade, there are safety elements to this that are considered pass or fail, no matter what stage you are in the black belt transformational learning program. And I'd like to again congratulate our blue belts on the weekend who really stepped up and exceeded their skills. I was interested to hear one of them remark that one of the master students who's joined the program left theatre the other day smiling because he found it a lot easier, a lot more comfortable, and he feels he's making progress. And that's a delight to hear from somebody who joined us, and he's joined us as a red belt, although he is on a master's in surgical program. But joining us at the red belt, he's going back to the basics and looking and re-examining that to improve his skills. Remember, Tiger Woods took time out to deconstruct his golf swing for exactly that reason. There are no egos involved in learning. And to become a master at a skill is a journey, and you have to attend to the basics at all levels all the time. And every one of these belts is not an isolated skill. They all add up to the skills that Chris Kelly mentioned and Prof. Seeley mentioned are third time redo, cesareans, and avoiding the bladder. It is important, and do not underestimate it. Thank you very much indeed for joining this evening. Thank you to all, and please follow John's instructions, and look forward to seeing you next week. Thank you.